Hello and welcome to the Fit News Podcast. I am your host, Jen Shaver. Listen, if you are feeling stuck, frustrated with your health journey, and ready to break free from the endless cycle of starting and stopping diets, I've got something just for you. The 14-day Rapid Reboot Challenge is designed to help you reset your habits, build strength, and boost your energy fast. If you are ready to feel confident and strong again without restrictive diets or complicated workouts, this challenge is exactly what you need. Hey, it's only 14 days and you will get expert tips, a simple plan, including a Strong for Life workout that can be done at home in as little as 15 minutes, along with the motivation to keep you going. Are you ready for it? Head to workwithjenshaver.com or click the link in the bio to get started today. So stop wishing and start doing. Joining me today on the Fit News Podcast is a very special guest, Dr. Emily Splichal, functional podiatrist and human movement specialist. She is the mind behind Naboso. With a spirit to challenge conformity, Dr. Splichal has taken her conventional podiatric medical degree and combined it with years of experience and expertise in human movement and sensory science to found Naboso. Dr. Splichal believes that our experience in this world is built around sensory stimulation and our ability to process, perceive, and integrate this information effectively. Now, since 2012, she has been traveling the world to share her unique approach to human movement, foot function, along with barefoot science. Having taught in 35 countries to over 25,000 professionals, Dr. Splichal has quickly become a sought-out leader in barefoot training and rehabilitation. And for that reason, I am excited to have her join us today. Welcome to the Fit News Podcast.
Thank you so much, Jennifer. It's a pleasure.
Yes, let's start. Let's go way back just a little, and maybe share what inspired you to move from maybe that conventional podiatric practice into barefoot science and human movement. How did you get started there?
Yeah, I think an important part of my story is that I was always an athlete. I was into movement, fitness, etc. I was a competitive gymnast for 13 years growing up. Happens to be a barefoot sport.
Yeah.
I did not appreciate the barefoot aspect of being a gymnast to the level I would now. But I had this appreciation for movement. So when I was going through my career, different phases, decided to go back to school. I was a personal trainer and within the fitness industry in New York City. And I was actually getting hurt a lot. So I was teaching classes and just using my body and getting injured. And I think a lot of that was because I was coming off of being a competitive athlete. Then I was teaching a bunch of spinning classes and my body was like, you might be 22, but you've been using your body for so many years.
Right.
So I looked at graduate schools of how I could stay within the movement industry. That's where I came into podiatry.
Yeah.
But as I was going through podiatry school, I stayed working as a trainer, group X instructor. I stayed within fitness with that deep appreciation for movement.
Right.
As I was going through podiatry school, I started to realize that it was very isolated. And what they were saying and teaching us in podiatry school didn't mesh the integrated appreciation for movement that the fitness industry was giving me and being an athlete.
Right.
So that's where I started to question and say there's got to be more, etc. As I got into my surgical training, which is required as a podiatrist, you have to learn to do surgery. That very much conflicted with how I look at movement and functional movement, etc. So I actually left my residency, went back to school, and I got my master's in human movement, which is a really important part of my story and my career. And me getting my master's during that time, it was the barefoot running boom, if you remember, 2008,
Oh yes.
2010,
Oh
etc.
yeah. What was the book?
Born to Run.
Thank you.
Yes. So this is all happening at the same time. So when I went back to school to get my master's in human movement, I decided to focus on barefoot science. And I started looking at and researching and really exploring that aspect. After I got my master's, I went back to residency to learn to be a surgeon because it was required. But as soon as I got into private practice, I really brought my fitness background, obviously my podiatry clinical training, but
Right.
then the bridge was this master's in human movement with a focus on barefoot science. And that is really what shaped the beginning of my career.
Yeah. It sounds like a very holistic approach.
Very much holistic. And that appreciation for holistic, in addition to being a gymnast, started with probably my mom, who gave us vitamins and believed
Yeah.
in really vitamin healthy lifestyle. When I was a teenager, I remember we used to get vitamins for Christmas. And I loved it. I was like, yes, I got vitamins. So clearly there's this
Yeah.
installation of beliefs that I have from a very early
Yeah.
age
Yeah.
that I love anti-aging or longevity medicine as well. That's an
Right.
important part of my practice.
Yeah. 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 Don't worry. I have a whole drawer of supplements. So, so I understand.
Yeah.
And my daughter does too. She has her own drawer. So, so yes, I guess I'm doing the same thing to her that your mom did for you, right?
Yes.
So let's talk a little bit about the importance of having that strong foundation, which are our feet.
Yes. So our feet, which is the only contact point between the body and the ground, acts as our body's postural and sensory foundation.
Mhm.
Oftentimes I will make it similar or analogous to the foundation of a building. And if the foundation of a building or a structure is not stable, obviously everything above it will not be stable. And we want to think that same thing with our body, with our posture. If you think of someone who has flat feet where the feet are collapsing in, they're dropping their arches, there's this effect that happens up the legs where we get this internal rotation and the knees knock, the pelvis can roll forward, and those are all skeletal positions that make it very difficult to stabilize. So mechanically, our feet are our foundation through which the rest of our posture sits. But then similarly, my passion is always within the sensory side, the neurosensory side. Our feet, the only contact point is really the skin in the bottom of the feet. And the skin in the bottom of the feet, which has thousands of nerves, is designed to read and adjust to every step that we take. We use that information to absorb energy and impact forces, to trigger the stabilization of our deep core and our glutes so that we can stand and walk and jump and do all this dynamic activity. Really lies with both that sensory and mechanical foundation that is really what makes the human foot so fascinating.
Yeah. So let's talk about because you kind of touched on it with the flat feet and the knees, turning in. And I mean, somebody might not even think, they might say, geez, I have really bad knees or I have really bad hips. They might not really be making that connection that, oh, this is starting. It's not really my knees, right? Or it's not really my hips. That's just the side effect of what's happening with the feet.
Yeah, absolutely. And that's why I teach professionals, patients, consumers, everyone that we do need to think about our feet because of
Right.
how interconnected the body is. Unfortunately, if you go to, let's say, a orthopedist who's focusing on the knees, they may not necessarily say, take off your shoes, let me see you stand, walk, etc. It's just not the way that Western medicine is really taught, unfortunately. A lot of orthopedists are also thought from a surgical perspective of, okay, if it's not surgery, if it doesn't require surgery, I can't help you, go to the physical therapist, etc.
Yeah.
So I spent a lot of my practice then training and teaching physical therapists to be the voice of intervention, let's say, or chiropractors who will then look at the whole body and say, okay, what really is causing the stress to the knees or the
Right.
misalignment to the knees? I have to look at the bottom, which is the feet, and I have to look above, which is going to be the pelvis and the hips,
Right.
just in this example of the knees.
Right. Right. Yeah. I mean, and we know that, what's the statistic? 80% of the population will have back pain sometime in their life. Well, is it related, right, to what's going on in your feet?
Absolutely, 100%. And then that just the example of the knees, obviously you can go further up
Right.
because every movement of your feet causes a movement or a rotation of your legs. As your legs rotate, your pelvis goes forward and back. So now you're obviously affecting the low back position. The lordosis
Mhm.
could be, you could look at it structurally or skeletally that way, but then it also affects the timing and the ability of your abs, your pelvic floor to stabilize, which
Mhm.
affects your glutes to stabilize. And there's a lot of muscles that essentially interplay with how we stabilize and transfer stress.
Yeah.
And the low back is definitely one of those areas that it just gets dumped in.
Right.
And that's where, if you understand how to affect the foot, how to control your foot posture, I
Mhm.
teach that a lot. And I teach people, okay, move your foot. Okay, I want you to feel. Now I want you to understand how to set your base. How do we find a stable foundation? What does that look like? What does that feel like? Once you connect to that, I want you to actually now associate that to your lower back. How does your lower back feel? How does the alignment of your lower back and your pelvis feel? And then all the muscles that stabilize it. And that's an important part of my practice is
Yeah.
ownership, that people take ownership of their body, of their posture, of their movement, of their health. And it
Mhm.
starts with knowing what is your foot type, what's your foot foundation, and how do you influence it?
Right, right. And, you know, again, it goes back to the analogy that you used regarding the building, right?
Mhm.
If we build it on a strong foundation, then the building is great. But if that's a weak foundation, if your feet are weak, then the rest of the system moving all the way up,
Mhm. Yep.
it's a domino effect.
Yep.
And, you know, that's why, you know, if you are somebody who has been struggling for years with your knees or your back, and you've never addressed your feet because nobody ever said anything, maybe this would be the wake up call to say, aha, maybe I need to look at what's going on in my foundation.
Yeah, 100%. And there's a plethora of information on
Mhm.
the internet and podcasts. And
Mm.
that's why I love being on podcasts such as
Right,
this, because it's a way to inform the end user, the consumer, the patient, the individual, right?
right.
About that there's more to the story oftentimes than what we are told
Uh-huh.
by a medical provider, just simply based off of their historical training. It's no fault to them, it's just the way that they're trained,
Right.
right? So that's why we do need to explore.
Mhm.
And the internet has made that such a broader, I guess, opportunity to seek information about your own health.
Yeah, yeah. Let's chat a little bit now about the company that you founded and all that it has to offer and how it can really help someone to build that strong foundation.
Yes, so you're referring to Naboso,
Yeah.
and Naboso is a sensory-based product line that I started 5 years ago. And in the bio that you had said, my passion is really built around sensory stimulation,
Mhm.
that to optimize our movement, to optimize our posture, our health. That story begins with sensory stimulation, sensory perception. Do you feel your
Mhm.
feet? And once you feel your feet and the information that's coming in, do you know how to process it and actually use that information? So that's a big part of why I created Naboso.
Mhm.
Now at Naboso, all of the products, I have a little textured ball that I'm
Oh.
showing on it. All the
Mhm.
products have these little tiny pyramids on them,
Mhm.
and these pyramids are stimulating a very specific nerve in the bottom of the feet. It is the
Oh.
same nerve that we use to read Braille. So when your hand reads Braille, you are
Okay.
stimulating the same nerve as the Naboso texture.
Oh.
When you stimulate that nerve, it is telling your feet slash body where you are in space. In addition, when you stimulate these nerves, it wakes up the muscles. And we have 26 muscles in the bottom of our feet. Those 26 small muscles in the bottom of our feet are used to maintain balance, to support foot structure, to absorb energy. So they're very, very important to overall movement function. And then in addition, our texture increases circulation. That's part of recovery. And you could think of the textures like a mini massage, which is part of the recovery as well.
Right.
So all of the Naboso products have a focus on the foot
Mhm.
or the hand. It's primarily foot because of being a podiatrist, obviously.
Yeah.
But the nerves also extend to the hand. So a lot of people will use the Naboso products for hand recovery,
Oh,
hand stimulation, hand strength, thinking post-stroke, or a lot
right.
of people who do racket sports like pickleball is a huge
Yeah.
one, golf, things like that. You can use that for stimulating the hands.
Okay.
But yeah, we have a full product line that features that texture focused on awareness, strength, and recovery.
Wow. Yeah. And I think I would venture to say that many of our listeners did not realize that the foot had 26 muscles. And
Yes, and there's a lot of bones and joints and
yeah,
ligaments in there as well. So they're
yeah.
they're very complex. But the importance of those muscles again is I think of them almost like the deep, deep ab muscles, like our pelvic floor.
Hmm.
Very, very similar in how they function, is they play a very important sensory slash stabilization role in
Hmm.
overall foot and posture and movement function.
Yeah. And now so you had mentioned the sensory aspect. Tell me, why is that important? And then as we're talking about why that is important, you know, are there changes in that as we age that as a midlife woman, she should be, looking at, thinking about, what do I expect?
Yeah. So the nerves in the bottom of the feet, they're very special nerves. They're called mechanoceptors or touch nerves. And as I'd mentioned earlier, our feet are designed to read the surface that we stand and move on. That's very, very important. It is technically in the background.
Hmm.
So the awareness of feeling your feet and the ground isn't it's not like this conversation that we're having, which is very in the front of our brain, right? There's
Hmm.
something that's happening in the background. Yet, even having said that, we still need to subconsciously perceive our feet.
Hmm.
If we do not feel our feet in the ground, which happens in the case of neuropathy. So, in neuropathy, whether it's diabetic, idiopathic, chemo-induced, small nerve, there's many different types of neuropathies where people start to lose the sensation of their feet. That is the most apparent effect of what happens when you don't. So
Hmm.
people start to feel unstable. They don't know where their feet are when they're walking. They can't feel each step that they take. They actually get very scared of moving. So they lose what's called movement confidence. They lose balance
Hmm.
confidence. In that case, that is very disconcerting to the individual. And now the awareness that is usually in the background is forced to be in the forefront, which means they can't walk and talk at the same time, right? Like there's
Hmm.
whole dual tasking. And this is really a fascinating demonstration of the nervous system is that it can multitask or dual task.
Hmm.
So I can walk, stabilize, walk on a pebble path, let's say an unstable pebble path, and be making decisions of how I'm going to navigate people walking towards me, possibly while having a conversation that I'm with someone I'm walking with and holding a coffee. Like
Right.
that's a lot that's happening in your nervous system that if you don't feel your feet, which is kind of that first layer of stabilization of how we relate to the pebble path and our posture and our movement,
Hmm.
all of those other multitasking, dual tasking things are not possible, which means you can't walk and talk at the same time. You have to be very aware of how you're stepping. You might actually stumble or trip. You might bump into someone. So the accuracy of the movement will go down. The speed of our movement goes down. So we become very almost overly cautious.
Hmm.
And what happens, I often give the analogy of when you're riding a bike, you actually fall off of a bike easier when you go slow.
Yeah.
So you want to, you have to kind of find the momentum, etc. So the slower we move, or the more cautious that we are when we move, your fall risk actually goes up. And that's why we want to have this automation of movement, stabilization. It has to be in the background. Naboso and all of our products, like our insoles and our socks with the texture, are essentially a way to help you feel your feet more, so that can go in the background. So now we can move faster and we can walk and talk at the same time.
And so in terms of wearing these products, how often and how much time should one spend wearing them?
Sure. So it depends on what you're using them for. We have our socks, just as an example. Our socks have that same texture on the inside. These could be seen as, is this just a form of recovery? I'm going to wear these when I wake up in the morning and I wake up my feet and I get ready for my day. I take them off, I put on my day-to-day shoes, I go do my day. That's a way to do it.
Yeah.
These could be worn when doing exercises. So if you're going to wear these when you do Pilates, as an example, we have grips on the outside. Now you're just a little bit more tuned into your feet when you do the workout. Again, it's just an example. In the case of neuropathy that we were describing, someone who has decreased awareness of their feet actually needs the stimulation to maintain their balance and to walk the right way. So for that individual, they might want to wear our insoles or our socks all day, every day, in their shoes, around their home, as a way to continuously say, okay, there's my feet, there's my feet, there's my feet.
Okay. And then what about, let's talk just briefly about where we started, kind of that barefoot science, right? And that whole craze about, barefoot running and all that. What do our listeners need to know about, the science of being barefoot?
Yeah, so that makes me think of shoes.
Yeah, right.
So yes, so
I
knowing,
didn't want to throw anybody under the bus, but
right.
stop wearing those heels you're wearing.
I know, and the thick cushion shoes. So in the case of footwear and appreciating the thousands of nerves in the bottom of the feet that are designed to read the ground, any sort of interface that you put between the foot and the ground, such as a shoe with cushion, is going to take away that sensory information, which means now you are moving not exactly to the extreme of someone who has neuropathy, but you are now sensorily disconnected from the ground. You are more sensorily disconnected from the ground.
Yeah.
The important information that comes from the ground is part of what triggers how we stabilize, how we activate our core, how we activate our glutes. So you could say that as soon as we put cushioned shoes on, we become a little bit slower in how we feel and stabilize with each step that we take, right?
So we essentially could be, becoming lazy, quote unquote, if you will.
Yes.
The muscles are becoming a little lazy.
There are research studies that show that chronic use of supportive shoes, cushioned shoes, arch supports does cause atrophy and denervation of those 26 muscles in the bottom of the feet. So yes, you could say there is this chronic use of shoes cause this deleterious or this negative effect on foot strength and foot health, right? Now, having said that, shoes are a reality. So what I tell people to do is, if you can navigate more of a minimal shoe that has less cushion, less structure, you can twist the shoe, it has a wide toe box. That's what I advocate in a majority of cases. If you cannot tolerate that, how do we find this middle ground? Maybe a little bit of cushion, maybe a little bit of drop. Maybe you wear a minimal shoe, but you put a arch support in the minimal shoe. Then, in addition to that, everyone needs to strengthen their feet with exercises. So if I prescribe custom orthotics for a patient in my office, I am still giving them foot exercises. If they're in minimal shoes, they are still doing foot exercises. They still release their feet every night. So it's about finding this balance that works for the individual, their reality, their foot type, so that we can achieve as optimal of a healthy foot lifestyle as possible.
Yeah. And so I know you said, you will use orthotics here and there, along with prescribing the physical therapy to strengthen the feet again. So there is hope for people who, currently, might be struggling by doing certain foot exercises. They can strengthen those muscles. It's not once they're gone, they're gone.
Correct. Yes. And I have a lot of resources online to strengthen the feet. I actually have a book that's a great, essentially a cliff note or a summary of everything that we're talking about. It's called Barefoot Strong. It's available on Amazon. It's also on the Naboso website, Barefoot Strong. And that really, it's a quick read summary of these are different foot types. This is how to determine your foot type. This is how to start to strengthen your feet. This is how to keep the nerves stimulated, how to keep your collagen elastic and rubber bandy. And then it essentially goes into a series of exercises that are based around barefoot balance training. And to me, doing barefoot single leg exercises is one of the most effective ways to train your foot muscles, your foot to core connection, which is really important, and then your glutes. So those different pathways are really, really important to really walking. Walking is the most foundational functional movement that we do every day.
Yeah.
So all of my exercises are guided around getting you to walk optimally and to have the stability and the foot strength that is required to walk the right way. So that book, just as an example, is one of the best ways to kind of get a summary of everything that we're talking about, because yes, there is hope.
Yeah.
for
Yeah. Yeah. Well, and that's just it. You mentioned walking, and I know so many women love to go on walks. And, right now they might not be having any trouble, but, 20, 30 years down the road, if they're not making sure that their foundation, that their feet are strong, and they're wearing these big, huge, I won't throw any company under the bus, very large soled shoes,
Yes.
to go on these walks, they're really doing a disservice for their feet down the road.
Yeah. And one thing that I want to share about these midlife hormone changes, just
Yeah.
because you
Yeah.
brought up that age demographic and female, is that as the hormones change, it starts to affect our connective tissue. And we have over 100 ligaments in the foot. So you can start to see the foot shape changing. You might start to see the arches dropping. In addition, there is a muscle, it's called the posterior tibialis. It wraps around the inside of your foot, inserts onto the inside of your arch. Very common for women who are postmenopausal to get excess strain to that tendon, again, because of hormone changes. And they get what's called adult acquired flat foot. And they get this drop of the arch. Oftentimes it happens on one foot. Can be very painful, but if you lose the structure on one foot and not the other, well, now imagine what that does to the symmetry of your leg length, to the symmetry of your pelvis. Well, now we essentially have a limb-like discrepancy. Your pelvis rotates, and now we're dealing with all of this. So it's something that I try to bring an awareness to for women, particularly, to understand that there is an effect on hormones, on connective tissue, which includes ligaments, tendon, right? As far as foot structure and foot posture. And what can we do to offset that or to maintain sufficient foot strength so that that doesn't happen to us?
Yeah. 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 Because I think, a lot of women, again, might start to have, pain in their hips or pain in their back and not put it together that where did this originate?
Right.
Yeah.
Right.
Yeah. Wow. Dr. Emily, one final thing, if there was one thing that you want the listeners to take away from this episode, what would it be?
So my go-to tip to start to appreciate the feet is to release them every day. I would recommend the neural ball, but I'm biased because of developing the product. But if we can release the feet in the morning, in the evening, I tell people to use, if it's the neural ball, if it's a lacrosse ball, golf ball,
Right.
I want you to just release your feet every morning, evening, do it when you brush your teeth.
Yeah.
I leave the neural ball, this is actually a new product that we're launching, so it's not the neural ball that splits into two pieces,
Mhm.
but I leave the neural ball in front of my bathroom sink. And
Mhm.
I've been doing this since I was a second year medical student. So that was a while ago here
Just a
now.
few years ago.
A few years, but I've literally been doing this practice for well over 15 years,
Yeah.
every day, morning, evening. When I travel, I pack it, I put it in my luggage, my hotel room, I put the product in front of the bathroom in the hotel. I literally do this every day. And it is my kind of my cheesy saying, how they say an apple a day keeps the doctor away. Here, mine is doing a foot release every day keeps the podiatrist away.
Yeah.
So
There you go.
it's a great way to start to connect to your feet.
Yeah, well, you know, the thing that I love about what you just said is you made it so it wasn't this whole new production, right?
Mhm.
You're already brushing your teeth. You're already doing something, right?
Yep.
Okay, so if that doesn't work for you, put it on your nightstand, you know, and before you get out of bed, right? Or, you know, put it in your kitchen and while you're making your coffee, put it at the most, you know, the place that you're going to remember to do it. And also the place where, you know, it becomes just part of that. So it's not this one more thing, because the way that you suggested, it's perfect. You know, it
Yeah.
fits into the everyday life. And that's what's so important with, I think, as fitness professionals and medical professionals, that, you know, we try to get people to understand it doesn't have to be this whole big thing, that there's ways to fit these habits into their life so that they just become part of their lifestyle and it doesn't have to be overwhelming. So I love
That
that you said that.
very much about my approach to foot health
Yeah.
is I try to make it as seamless. That's why I also love toe spacers,
Yeah.
because you can just slide them on when you get home or at the end of the day, and then cook dinner, hang out with your family, literally do what else, like everything else that you're going to do. Or like the Naboso recovery socks, just slide them on and walk around your house, because you're going to walk around anyway. And then it makes it very achievable, let's say.
Yes. Yes. Perfect. Well, if the listeners want to find you, more information on you, and more information, more importantly, you know, on your products, where can they do all of that?
Absolutely. So on Instagram, my handle is the functional foot doc. I do see patients both in person and virtually. So most of my patients are actually virtual. If people are just curious to learn how I see patients and my approach to patients and foot health, my website is the exact same. So thefunctionalfootdoc.com. And then for any of the Naboso products, that website is naboso.com. Naboso.com, naboso.com. And then we are also on social media, Naboso_technology. And again, that book was called Barefoot Strong. It's on Amazon. You could also go to barefootstrong.com. And that's where I have my foot type quiz. So you can determine your foot type, and then it starts to guide you in what you can do. I have a lot of resources online.
Awesome. Wonderful. Well, thank you so much for taking the time to share all your knowledge and help us to build that strong foundation in our feet.
Of course, it was a pleasure.
Yes. Thank you for listening to the Fit News Podcast, and we will catch you next time.